Okay, I think we'll go ahead and kind of get started. Everybody hear me? We all right? Good. I'm Dave Rose. I'm El Paso County's Public Information Officer, and I'm just going to kind of introduce the folks who know what they're talking about here tonight. And I'll also sort of act as the enforcer, so we kind of stay on schedule and we don't all get home at 9:30. So anyway, once again, welcome to Centennial Hall. I saw a lot of you out there looking at the black and white photographs in the lobby. That is the photography of Glenn Murray. It's about 1930 to 1960. He was a photographer who worked with the Public Works Department of the City of Colorado Springs, so that's why all those public works projects. It's great looking into the history of our area. Those prints are available for sale through the Old Colorado City Historical Society. And then one other point, while I'm on that vein, at the back of Centennial Hall and lit are murals from the 1930s. They're Depression-era original paintings. They depict great fairy tales. This is a permanent exhibit that has been given to the county from Denver Public Schools. And we certainly invite you to take a moment and look at those as well. The purpose of tonight, of course, is to have the opportunity to meet and greet our new Public Health Director, Dan Martindale. Dan has actually been with the county for a while.
20 years.
But not in this role, and we'll get to know a little bit more about Dan. The format tonight is we have presentations about the role of public health, El Paso County Public Health. Most of you know that El Paso County Public Health serves all citizens of El Paso County in all municipalities. And we'll talk about what they're doing. Those of you who are here wondering what El Paso County Public Health has to say about Ebola, we will also go through that for you as well. At this time, I'd like to bring up two of our El Paso County Commissioners, and we can bring up one at a time. We have two county commissioners who serve on the Board of Health, Amy Lathan and Sally Clark.
Thank you, Dave, and I'll pull this up here. Thanks, everybody, for coming out. We really appreciate you coming out and showing interest in the services, of course, that are provided to all of you through El Paso County Public Health. We do want to talk a lot about the services. There are so many that we have that are for the citizens of the county, and of course we've got some hot button issues as well, and we will address those. We want to be as informative as we possibly can. There will be an opportunity to ask questions and provide answers and talk about any concerns. We just very, very much appreciate you being here and the ability to be able to share with you some of what public health does. We have, in the past couple of years, had pretty extraordinary experiences, of course, as we've gone through the disasters that we've had here locally. And the amount of work and the incredible piece of recovery that's represented through El Paso County Public Health is pretty extraordinary. And I think important for people to understand and recognize what that means in terms of all aspects of recovery and the way we are able to provide services and respond to people. So we're here to just provide information, welcome all of you, and hopefully answer questions and get some good information out. And I will introduce Sally Clark. Sally and I are both on the Board of Health, and very glad to have you here.
Thank you. Figure out this microphone. I'll just hold on to it for a second. Thank you, Dave. Well, as Commissioner Lathan said, we appreciate you being here tonight. There's obviously been a lot of activity in the news about public health in the last couple of weeks, and in fact, the last week or so. It's about all you see. But, I think it's important. We talked about doing this introduction for our new public health director, Dan Martindale, because we felt that not only is it important for you to understand why counties matter, but it's important to understand why public health matters. And if we're doing everything right, you don't really know that we're doing much because it happens really seamlessly behind the scenes. I wanted to mention we have some of our fellow Board of Health members here, and if you could just stand up when I recognize you. Kari Kilroy, who's the president of the Board of Health, and we have Victoria Brorman. We have Dr. Robert Bucks, and he's also our county coroner, C.J. Moore, and we have Councilwoman Corrine Toll, who's also here from Manitou Springs. So let's give them a round of applause and thank them for being here tonight. Just basically, I appreciate you being here tonight. I think it's important, too, as we talk about the various issues, that we have expert professionals up here that are going to address a number of public health issues, and it's important to talk about facts, not about fear. We're going to really try and give you the information you need on so many public health issues that are sometimes in the news and sometimes not, but all important to our community, especially as Dave pointed out with regard to the recovery efforts. So thank you, Dave, and I'll pass it back to you.
Okay. Thanks, Commissioner Clark. We'll have our panel members, and I'll remind the panel members, those microphones don't have to be terribly close, but you do have to speak into them head on as opposed to off to the side. They are directional. Anyway, want to introduce our panel up here, and of course we'll go to Dan Martindale here in a moment. Dr. Bill Letson is the Chief Medical Officer, Medical Director for El Paso County Public Health. He is right here. Next to me is Tom Gonzalez. Tom is the Environmental Health Director, and then Lisa Powell is over on the other side, and she is the Emergency Preparedness Program Director with El Paso County Public Health. And at this time, I'd also like to acknowledge, and I think Commissioner Clark acknowledged Kari Kilroy she is also here representing Memorial Hospital, and is president of the Board of Health, and Lauren Schrader, who is here from Penrose St. Francis, up in the back. And with that, our new Public Health Director, Dan Martindale.
Thanks, Dave. Well, good evening, everyone, and I certainly appreciate you coming out this evening. I know most of you have probably had a very long day already, but this is a great opportunity, I think, for the Health Department to tell you a little bit about the activities and plans that we work on a daily basis, no matter what the emergency may be, or perhaps thinking about emergencies in the future. I am not new to the county. I have worked with El Paso County Public Health for 20 years. I think I have just about worked in every program over those 20 years, so I guess I'm a good example of working my way up. It's only taken me 20 years, so I am so privileged and honored to be working for you as the Public Health Director. It is a serious job, and thankfully I've got a lot of concerned and great citizens here in El Paso County. Also, I have a great staff that works with me, not for me, but with me. And we've got some of those folks up here on the panel today. I just wanted to briefly mention, for those of you that may not know what our mission is, and I think we're going to have a slide up there. Or not. So, the mission that guides us, as you can see, is to protect and promote public health and environmental quality in the community through prevention, people, and partnerships. And the three key words in our mission are prevention, people, and partnerships. We could not do our job at the Health Department without the numerous collaborative efforts that we have, the different organizations and partnerships that we have. If you think back to the two fires and the floods, there's a lot of things that we as a health department do, but we could not do it without working with and training with folks at the national, state, and local levels here, especially in El Paso County. So that's our mission, and really our roadmap that we use are called the 10 Essential Services. I'm not going to read through the entirety in detail here, but you can see that there are 10 key words that really guide us as we're putting together our plans, as we work on a daily basis. We monitor health status for community health problems, diagnose and investigate health problems for potential hazards in the community. We inform, educate, and empower. And I think this is a real important service that we provide. Most of you may think that we just work on emergency situations, but we have so many other programs that benefit our citizens here in El Paso County. Our WIC program, which is a supplemental nutrition program for 15,000 clients actually that are in our WIC program, that we assist, educate, and provide vouchers for so that they can supplement their diets with nutritional foods. So we also mobilize community partnerships to identify and solve health problems. We've been doing that since I've been with the health department for 20 years. Obviously, the E word, or Ebola, which we'll be talking about a little bit about today or this evening. We've had numerous meetings with other partners within the community talking about, in the very unlikelihood that Ebola should show its face here in El Paso County, what will we do with our partners to make sure that our citizens are safe. Develop policies and plans that support individual and community health efforts. Enforce laws and regulations, for example, our retail food inspections that we do, making sure that our food is safe here in El Paso County when you go out to one of our over 2,500 retail food establishments. And Tom and his staff certainly are instrumental in doing that and making our food safe. Link people to needed personal health services. We're actually in the process of putting together a project and a plan to have some patient navigators at the health department working with our Department of Human Services and Rick Bankston and his staff at Department of Human Services to actually assist people in referring them to the Department of Human Services and vice versa. The Citizen Service Center, where we're located, we have several other beneficial programs to our citizens to make it a one-stop stop, so to speak, and also some of our community partners to refer our clients and get them hooked up with the needed services that they require. Assure competent public health and personal health care workers. We're constantly training, looking at best practice, developing materials for the community to make sure that you have the most up-to-date public health information. We evaluate effectiveness. We don't just willy-nilly put together a program and throw it out in the community and hope it works. We do a lot of behind-the-scenes evaluation, looking at best practices and so forth to make sure we're being as efficient and as effective as we can be with our programs. And finally, research for new insights and innovative solutions to health problems. And just very briefly, we're going to be looking at bringing some medical students to the health department here in the next few months to actually have them do some rounds with public health. And just maybe once they get out of medical school, they may decide to be public health in the public health arena, and just like Dr. Letson here, maybe be a medical director for a local public health department. So we are guided by the 10 essential services. And then finally, I just wanted to mention that we do, no matter what the emerging situation might be, or non-emergent situation that we might be dealing with, whether it's an emergency or trying to come up with better ideas and solutions for programs that we've had for a number of years. There is a national public health network that we are integrated within for Ebola or other particular issues that may be emerging here. We work with the Centers for Disease Control. We follow their guidelines. And those guidelines go through the state health department, the The state health department then communicates with us at the local level here in El Paso County Public Health. So we aren't just making things up as we go. We definitely have a plan, and we work with experts in the field of public health at these three levels: national, local, and El Paso County. So with that said, what are we wanting to accomplish here this evening? I've mentioned that we do address infectious disease. Some of you may remember over this past summer we've dealt with rabies, tularemia, plague, and now Ebola has come up. And like I said, we will talk about that. But we also want to talk a little bit about the facts surrounding Ebola, like the commissioners mentioned. We want to talk about the fires and floods and preparedness that we had in place. Oftentimes you see the first responders in the media, but you don't recognize the fact that your public health department is really working hard to come in after the fire is put out, for example, for cleanup, to making sure people are not keeping their spoiled food because there were no utilities, making sure drinking water is safe, making sure the air quality is good, even after the fire has been long extinguished. When people come and start building their new homes and construction, there's a lot of dust and those sorts of things put into the air. So I know Tom and his staff had been really working with the construction outfits and contractors to make sure that they were watering the dust down so it didn't travel and cause breathing difficulties. So at any rate, I just again want to thank you. I feel very privileged to be here this evening and to be your public health director for your health department. So with that said, I'll turn things back over to Dave.
Thank you, Dan. At this time, I think I'll bring Dr. Letson up so he can kind of drive the PowerPoint. Dr. Bill Letson is the medical officer, medical director for El Paso County Public Health, and we'll turn the magic clicker and the microphone over to Dr. Letson and let him take it from here.
Okay, there we go. I'm sorry, I need to. Okay. Don't mess with the equipment. By way of background, I am a pediatric infectious disease doc, and my career has been involved in field vaccine trials, communicable disease, public health, which is most of what I do here. I'm really responsible for the communicable disease outbreak and investigation team, and messing up the equipment. And I've worked all the way from Centers for Disease Control down through 3 different state health departments, and now here at a local health department. I am from Colorado, by the way. I'm from Parachute. I'm a certified HIC. So, really with that, and I have some experience overseas, not with Ebola, but with working on dengue virus in Latin America and Asia. And what I want to point out first is that what we do, the Communicable Disease Investigation Team, is really focused on monitoring over 60 different infections that are legally reportable by Colorado statute. And this is something that we do 24/7. I'm not sure, but what one of my staff members in the room here has this little purple thing that we call the bat phone that people can call literally 24 hours a day with either questions, or a hospital lab or provider may have to report something that's serious enough to get you out of bed in the middle of the night. And this is all part of a process of identifying disease threats to the public health. And what we really want to do with that is limit and control the spread of diseases in the community. And we do that as a part of this network that Dan was alluding to a moment ago. We are really sort of circularly, linearly tied up with primarily, and first and foremost, the state health departments, CDPHE, but also CDC, and occasionally, we'll communicate with CDC before we communicate with the state. It just depends on the circumstance. And I want to use these as examples that there, as I mentioned, at least 60 things plus emerging infections, some of which I've listed up there, i.e. something that comes along that's relatively new to the system that we monitor. These are just examples of what we do on a day-to-day basis. And to take the more ordinary things, you all are harangued by us every year about influenza. It's a seasonal thing. Begins circulating in the fall and usually goes through winter and spring. And it can be serious. As Dan mentioned, we'll talk a little bit about Ebola, and I think one of the things to point out is that influenza kills on the order of 2,000 to 3,000 people a year across the United States. And in some years, a much larger number, which I'll talk about in just a moment. Foodborne illnesses, Tom is going to talk about as well, but this is a big part of what we do. From getting calls about, oh my goodness, I ate at a restaurant and I'm ill now, and then we sometimes we'll be following up on this and actually identify causes, but there are also outbreaks in places like long-term care facilities or child care facilities where you've got a relatively vulnerable population, and we have a role not only in the early identification, but then in contact tracing. If you have somebody with a case of salmonella, for example, or norovirus, then we get involved in actually tracing people that they may have exposed and doing everything possible to make sure that they get treatment, prevention, and taken care of, and that they don't expose anyone else, emphasizing various aspects of hygiene and so on so that we can prevent illness. The emerging infectious diseases, some of these I will say are no longer emerging. West Nile, for example, that is now with us permanently. But if you go back to the beginning of the millennium, it was introduced from its native source, which was in Africa, and then gradually spread across the United States. It hit hard here in 2003, roughly 10 years ago. And so we were very involved in monitoring that, getting out public health messages, and basically doing a number of things that Tom will talk about in more detail to basically teach people how to protect themselves from a mosquito-borne illness. Sort of number 2 flu here. We talked a little bit about seasonal flu, but you probably all remember hearing a lot about pandemic flu. This is a strain of the flu virus which has the capacity to change itself over time. It literally evolves very rapidly. And we are always on the lookout for a strain that is far more severe than most of the seasonal circulating viruses. And there was the expectation in 2009 that this was going to happen. It did. It was more severe. For example, the estimates are that probably this killed roughly 8,000 people in the United States at that time, and many, many more than normal worldwide, and certainly was more severe in terms of putting people in hospital, and like the old 1918 pandemic, affected younger people more. 2/3 of those deaths in the United States in that year were in people under 65, whereas seasonal flu has a tendency to be more severe in older and, well, at the extremes of age, infants and older people. So we got involved in mass immunization efforts, collaborating with a variety of emergency medicine folks, finding sites for these mass clinics, etc. All part of what we do normally. You've all heard a good deal about enterovirus 68 this year. enteroviruses all circulate at this time of the year, and polio, for example, is an enterovirus that we fortunately don't see here anymore. This particular one has what we would say, it goes for the lungs. So kids with asthma and things like that that compromise their respiratory capacity are really affected by this and put in hospital. There's been roughly 600 so far in the last couple of months across the country. And we have been a part of a network that's been monitoring that. We were involved in a survey here locally of our hospital facilities trying to determine if it's affecting adults. The answer is no, not much. It's probably because this virus circulates routinely, and most of us as adults probably had it a long time ago. But we're involved in all those things. And then finally, occasionally you have the introduction of something brand new into the United States, as has been the case with Ebola this year. Pretty much what happened with West Nile virus back in, it was either 97 or 98, I think. Someone literally flew in on a plane into New York City. Difficult for this to happen, but actually he got bitten by a mosquito went to the next person, and just the right set of circumstances, and that's how that happened. This has happened in a similar way, but one of the things, I'm going to say a number of things about Ebola, and the first thing is, unlike West Nile, this is not easily transmittable. This is what we call a blood-borne pathogen. That is, the virus lives in the blood. It does not live in the lungs, and that's why it's not, it can't be transmitted by aerosol. And what's meant by transmission by aerosol is I'm standing here with Ebola and I cough and Rick gets infected because these small droplets spread around the room. That doesn't happen with Ebola. It is a blood-borne pathogen, and it really puts people at risk who are in very, very close contact with an ill individual. That is, like family members who are taking care of somebody with it, or healthcare workers, and that's really who you see primarily getting this infection in places like Africa, where it's currently a major issue. This is the largest outbreak in history in West Africa right now, and we have witnessed a variety of outbreaks of Ebola since 1976, when it was first identified, and most of them have been relatively small, by people suiting up in protective gear and so on, isolating family members. It's been possible to stop it fairly rapidly. That, in fact, is what happened in Senegal and Nigeria in the context of the first outbreak. The Nigerians stopped their outbreak in Lagos by doing massive contact tracing, over 19,000 contacts in Lagos. And they stopped the whole thing with only 20 cases. That's typical of what's happened with Ebola in the past. These three countries that are experiencing it now, Sierra Leone, Liberia, and Guinea, all are countries that have experienced civil war for almost a 20-year period, did not have great infrastructure to begin with. The Nigerians have a pretty good health infrastructure. So do the Senegalese, at least in Dakar. These countries was never so good, and it's almost non-existent after 20 years of civil war. So they really just have not been able to handle this well. And the result is a big outbreak, and in spite of the odds, one individual managed to get on a plane from Liberia, fly into Texas, and introduce it here. The total as of October 12th was an estimated 9,000 cases. About 5,000 of those are laboratory confirmed. In the U.S., you all know, and I've just mentioned, the Liberian fellow that flew in, and he is the only fatality so far. Most of the others were flown in purposefully for care, as was Mr. Duncan himself, actually. 5 were infected in West Africa, and that includes the fellow in Dallas, a reporter, and 3 healthcare workers. And everyone with the exception of the Liberian fellow are doing well. Then he infected 2 of his healthcare workers, both of whom are doing well. I understand from Dr. Bucks that one of them was released from hospital today. The other one, I think, is still being treated. This group of contacts in Texas were a group of people who, in some way or another, some of them quite distantly, thought might have been exposed to Mr. Duncan. That group is all out of the woods now. The 21 days which it takes this virus to incubate is over. There are still a handful of people in Dallas that will be monitored who were healthcare workers that took care of him until he died. And so the 21 days is not up for them. But all of these contacts are past the period and don't have Ebola. And what I'm telling you by telling you that is that it really is our expectation that in the United States, this is probably beginning to wind down. This is the area that we're concerned about, just to give you all kind of a visual sense of it. Sierra Leone, Liberia, and Guinea, and you can see they've all got conjoint borders. So what we do here, if someone were to come into the Springs and show up with these kinds of symptoms, i.e. fever, headache, diarrhea, vomiting, muscle pain, some of which are very much like almost any other infection people might present with. And it's really key, you have to remember this and they've come in within the last 21 days from one of these countries, we'd worry about it. And what happens with those people is they would be immediately isolated in a private room with a private bath. Blood drawn, they would be tested and then referred to a care facility. But if they haven't been to these places, just anyone that walks in with these symptoms don't have Ebola. So that is really the approach. And we are working conjunctively, and Lisa, I think, is going to say a bit more about this general process, but we're working with first responders, hospitals, a number of entities here in the community around the issue of preparedness, as well as working with the State Health Department, which is quite active in this as well. And as I showed on the slide, right on up to CDC. I've mentioned some of this already, but we'll just go over at least the one that seems to be coming up constantly. This is not transmitted by aerosol transmission for the reason I mentioned. It's not a lung virus, so it can't get aerosolized. It's not transmitted by food in general, except it is thought that one of the ways this gets going in Africa is by virtue of people hunting primates, monkeys. And if they're not careful in their hunting practices, most of them probably don't have gloves on when they're skinning the monkey. They infect themselves that way and then go home, infect their families, and it just keeps going until it's stopped. The other thing that is good about this virus is that it doesn't survive in water. So we don't have to worry if someone comes in hospital and in their private bathroom with their diarrhea goes and flushes it down the toilet. The virus probably survives 2 or 3 minutes in water. It literally will explode because it's a blood pathogen, so it lives in a high, the same salt environment that we have in our blood. Ordinary water doesn't have that in it, so it will infiltrate the virus and literally pop it. Then on top of that, it's pretty sensitive to chlorine or bleach solutions. So the chlorination in city water supply plus the hyperchlorination when you get to the sewage removal system will kill the virus all over again. The virus, which is already dead, will be really dead. So I think the only other thing that I've not mentioned that's important to know, I shouldn't be saying good things about this virus because it's a nasty, nasty thing. But from a disease prevention point of view, this is a good thing. It is not transmittable until you have symptoms. Some viruses can be transmitted days before you have onset of symptoms. This one is not that way. So until you have the fever, the headache, and the rest, no big deal. And that's why when Mr. Duncan came across the ocean to Dallas, no one really worried about people on that plane because he didn't have symptoms yet. So they didn't go back and trace those folks. There was a bit of a question with the nurse that flew to Cleveland as to whether or not she had a fever. So they did the cautious thing and are tracing everybody, but it's very unlikely they'll end up having anything. And this, I think, is the finale, and I'll be quiet and move on. So the message with any of these infections in terms of how to stay healthy can be fairly generic. Admittedly, with any individual pathogen, there are a few different little things that you might do, but in general, if it's something like influenza and we have a vaccine, the important thing is to get vaccinated. And this lucky little girl is getting her flu vaccine. You may not know, you may wonder why she's not getting poked here. The current recommendation, it turns out that the attenuated live virus is just a little bit better in children between 2 and 8 years of age. So it's a brand new recommendation just this season that children between 2 and 8 get this in preference to the injection. It's okay to give them the injection, but they get to do this. A lot of kids this age probably prefer it. Frankly, I think this is kind of irritating. I'd rather get the shot, but hey. She doesn't look like she's too bothered there. Then, after that, even with something like influenza for which there's a vaccine, it's important to still do good hand hygiene. If you're coughing, sneezing, carrying on, please, wash your hands, take care of that, because you can, shaking hands, transmit it to someone else. For example, if I shake hands and get the virus from someone and then I turn around and do what I often do with my dry eyes and do this, you've just injected the virus right into a mucous membrane. The vaccine is not 100% protective, so it is really important, even if you've had the vaccine for this or something else, to continue to do these sort of hygienic sorts of practices. If you're changing babies' diapers, for crying out loud, wash your hands, because there's all kind of stuff in there that you really don't want for yourself and you don't want to be passing on to other people. The principle is the same. If you can, if you're ill, it's a good idea to stay home when you're sick, particularly with things that can be transmitted by the respiratory route. Good idea just to hang it up and stay home. Disinfectant solutions for use at home. You've got a baby table changing top. You can tell I'm a pediatrician, right? I think about baby poop a lot. But if you're dealing with that kind of stuff, the chlorine bleach will kill not everything, but most infectious agents. And so things like that those kinds of disinfectants are a good thing to use, just as a matter of precaution. Watching your procedures, and Tom can talk about this a lot because they inspect it in the restaurants. If you're cutting meat, on a board at home, you want to disinfect those things in between and not cross-contaminate by dumping your vegetables where you've been cutting on the meat, for example. There are just all sorts of nifty little things like that you can use to help protect yourself. And I think this is really why we're here tonight. Stay informed. There are a lot of good mainstream media outlets, and I have to say, I think that the mainstream media outlets have done a good job going all the way back to March when this Ebola thing started. It's a message somehow in this circumstance that is not being transmitted so well. So I guess that's the other reason we're here, is just trying to do our standard part of education and telling people what to pay attention to, and hopefully explain why it is this stuff isn't aerosolized. And we all don't have to worry so much about this unless we're on our way to Liberia or something. Then you might have to worry. I think that's it, Dan. Last year.
Thank you, Dr. Letson. And I should mention, if you have questions, we will take questions and answers in 2 ways. One, if you'd like to just write it down, we'll read them and get them answered at the end of the comments from our presenters tonight. And we should have some white cards kind of coming through with pencils in the audience. If you want that, you can just kind of wave and we'll make sure that you get one. If you prefer the county health plan, we do time you if you sprint up and down the steps, and we'll turn that into the Reach Your Peak program, and you'll get the points for it. No, that's actually a lie. How many thought they were here for D.L. Hewley? Anybody? No. Okay. He's next door, I think, over at Pikes Peak Center. I want to continue the program here with Tom Gonzalez. Tom is the Environmental Health Director with El Paso County Public Health. Many of us got to work hours and hours and hours and hours with Tom during fires and floods, because just as soon as the smoke starts to clear, we start having environmental health issues, and even before the water recedes, we start having environmental health issues. So Tom is here to talk about that part of the mission for public health.
Thanks, Dave. Good evening. My name's Tom Gonzalez. A little background with me is I've been in public health for 18 years in 2 different states, 3 counties. And I got my Bachelor's of Science degree in Environmental Health Science from Colorado State University. Go Rams. Have to put that plug in. And then got my Master's in Public Health from the University of Northern Colorado. So I'm both a bear and a ram. The Environmental Health Division works closely with community partners throughout El Paso County, whether that's county government, city, or municipalities, and our nonprofits. Well, really where we fit in the 10 essential services, I got to get to the next slide, there we go, is right here, investigating. We get over 40 to 50 complaints a month, varying from the pool looks dirty, the public pool, or I believe I may have got sick at my restaurant, my favorite restaurant, or they're surfacing sewage down the street coming from a broken sewage pipe or a failing septic system perhaps. And that's what my group's doing. They're out there looking into those complaints and dealing with those to make sure we have public health protection. The big thing with environmental health is we're protecting human health from environmental conditions. So we'll get a little more into that as I move on. But also education is a big key element in environmental health. Actually, my Master's of Public Health is in community health education, and using models to get people to perhaps change their behavior to better the outcomes. As Dr. Letson was saying, hand washing. One of the biggest causes of foodborne illness is lack of hand washings in a restaurant or sick workers in a restaurant. We know that. So that's one of our key educational pieces. Also working in child care centers, we're working with folks to make sure the children are washing their hands and the folks making their food, and then of course at the diaper changing table that we're washing and sanitizing those areas to prevent further spread of disease. We also work policy and planning. A lot of our environmental health regulations and policies, we work with many folks in the community, we call them stakeholders, to determine what is the most economic and viable way to protect public health. Of course, currently, our local regulations over septic systems, we have a local air quality regulations. We work with our Board of Health and the stakeholders to get those regulations on the books. And then enforcement, one of the key parts of us is actually doing the inspections. We do a lot of education in there. We get most of our compliance with whether it's a pool operator or a septic installer or a food worker by educating them properly on what the requirements are to better themselves and their health as well as the community's health. Again, our role really is informing, educating, and empowering people. We feel that the more knowledge people have, the better the outcome will be. We mobilize partnerships and link people to services. For example, in 2011, we formed the El Paso County Food Safety Advisory Group, which is consisting of 13 of our licensed retail food establishments, anything from a mobile unit all the way up to a large grocery store, a brick and mortar. We meet quarterly. We run policy ideas through them, ideas of improving our food safety education and awareness. And back in 2012, actually they formed what we call the Excellence in Food Safety, where we honor all the food establishments that have had no critical violations in 2 of their inspections. So it's a positive outcome. Of course, as Dave was saying, we respond to disasters and assist with recovery. And really, it's that long-term recovery. And I have a couple slides to illustrate how environmental health is helping rebuild communities. And then, of course, we enforce regulations. And food we eat, we want to prevent foodborne illness in our community. It is a big burden when we do have a foodborne illness. The water we drink, that is wastewater. We have about 34,000 active septic systems in the county, and we have a purview over that, making sure that they're operating and maintained properly. The air we breathe, we respond to complaints of dust or fugitive smoke, those kind of things. And then I put in here the places where we live, learn, play, and work. And that's like public pools, our child care centers. We got public health staff out there every day working with those operators and owners on preventing the spread of disease. Well, hot topics. This summer was a busy summer with plague and tularemia. Plague is a flea-borne disease, and tularemia is a tick-borne disease, which we found in wild rabbits in eastern El Paso County and tularemia in the Park Vista subdivision this summer. So because tularemia is commonly found in El Paso County and the southwestern states, we call it endemic, precautions to prevent tularemia infection should always be taken. Got one of my staff here that was out on a Friday afternoon after 5 o'clock working with the residents in the area that was infected and giving them public health alerts to make sure they understood what the risks are and how they can protect themselves from tularemia or plague. And that's just what we were basically, the education we were providing is leash your pets, make sure they're not in the areas where we have found the plague or tularemia, make sure children aren't playing in the areas perhaps where the prairie dog die-off was, they're not playing with dead animals, we just basic education there. We're also talking about, the wild animals, don't feed them, try to stay away from them if possible. Proper personal protective, wearing DEET if you're out to prevent the fleas from getting on you. Wear shoes outdoors so you're not out barefoot, potentially stepping on situations that may lead to an illness. And routinely use a tick and flea control on pets. And then a message for our hunters when it comes to wild rabbits, making sure they're taking precaution, just as Dr. Letson was talking about with Ebola, perhaps from our primates. That tularemia is very similar, and as it can be spread from an infected rabbit to the hunter when they're skinning the animal. So that was really our education this summer, when staff were door to door, as well as working with the community folks in the area. As Dan said, we're going to talk a little bit about response and recovery when it came to our 2 wildfires and 6 flood events we had in 2012 and 2013. Shortly after Black Forest Fire, it became very apparent we had a potential public health issue, and that was the destruction of many wells in the Black Forest area. So my staff immediately got with the Colorado Department of Natural Resources and surveyed over 500 wells in the impacted area. We determined about 100 wells had been impacted, either damaged by heavy equipment, fighting the fire, or burnt by the fire. And when you got to think of a well, you got to think of it as a straw into the aquifers, and it's the Denver Basin aquifers, and you have many layers within that aquifer. And when you have an open straw, you have potential for contaminants to get into that aquifer. So it was immediately we wanted to stop that potential. So we worked with community volunteers within Black Forest, La Ferre, the Baptist Church. They all rallied on a Saturday, and we worked with the citizens up there to temporarily cap the wells that had been impacted. And then we worked with those citizens to make sure they got those wells permanently capped through a professional well driller. And that's still going on today. We still are, some of the capped wells, we're working with the citizens on the best way to permanently fix that well. So that's still going on a year afterwards, but we're getting almost all of those taken care of. Also, folks that are on wells a lot of times are on septic systems, and many septics were damaged by heavy equipment running over the leach field or burnt. And we found actual pipes being heat burnt by the fire. So we put up a streamlined system, all electronic, working with Regional Building Department and El Paso County Community Development Services. So when folks were rebuilding, we were right there to assist with them getting that septic system evaluated to make sure it hadn't been damaged. If it had, getting it repaired properly. To date, over 300 of those septic systems have been evaluated, and 84 of them have had to get a repair permit to protect that the aquifer. So we're not having potential sewage getting into the aquifer. So that's been a success. Also, with both Waldo Canyon and Black Forest, staff were answering lots of questions about smoke, and as Dan was saying, indoor air quality, and how do I protect myself when I'm in the home in these devastated situations, digging through the ash and so forth. So we worked with the Colorado Department of Public Health, we worked with other state health departments that had suffered through these natural disasters, and we're getting out timely information for folks to protect themselves and their family when they were in those situations. And lastly, the big flood in August of last year in Manitou Springs. We had staff the following Saturday out on Manitou Boulevard Avenue working with the restaurants that had been impacted by flood waters, getting them as opened as quickly as possible to get the economy going back in Manitou Springs. But we wanted to make sure they were safely open so we didn't have a potential foodborne illness issue after that. And then lastly, this is a really, I've been doing that, like I said, 18 years, and this is one of those moments where you really feel like, aha, we're making an impact to our citizens. And when I was in the Emergency Operations Center during the Black Forest fire, it became apparent that we had, nearly 1,100 homes with either without power or their well was damaged. Well, how are they going to get water when they were coming back and when the sheriff was letting them re-enter back into the area? Well, I'm just lucky to have a journeyman plumber on my staff. He serves as our food program manager during the day, but he also dabbles in plumbing. And on a Saturday, worked with Colorado Springs Utilities as well as Park Vista Water that's up in that area to put together a water distribution center. And you can see the 4 spigots here. And we had 1-gallon jugs donated, so the citizens could come up here and get their water when returning home, at least had some potable water in the area. That was really gratifying, and the citizens were very appreciative up in the Black Forest area. So that's another example of how public health can play a role in after a disaster. And I think that is me.
All right. Thank you, Tom. And our last presenter here in the planned portion of the program, and again, if you have questions, we'll encourage you to kind of put those together. And I think our county commissioners have volunteered to go forth into the crowds with wireless microphones and make that available. Or if you'd like to sprint down, we have a microphone on a stand over there. Or if you'd like to just write it, you can do it that way. So we have a variety of options available for you. Lisa Powell is the Emergency Preparedness Program Director with El Paso County Public Health. And Lisa, as do I, as do many county employees, participate in a lot of make-believe. Only we make believe that things are really going badly and practice for how we're going to deal with that.
Thanks, Dave. So again, Lisa Powell with El Paso County Public Health, the emergency manager, and I have been with the county health department for 25 years now. Started out working with HIV and hepatitis C back when those were new diseases. So seeing new stuff come along and figuring out what to do with it is not something I've never done before. And my dad used to say that I was really good at creating disasters, so I should get in this business. So that's how I got started in emergency preparedness. At any rate, we're going to talk a little bit about our emergencies. No, she's going to do that for me. I can't chew gum and talk at the same time. So, all right. So, public health emergency preparedness. What is it that we've got going on? You can see several pictures up here of the types of activities that we do. Our preparedness is really the ability of the public health system, and that system is the public health department, your hospitals, your ambulance transport companies, your long-term care facilities, your behavioral health organizations. All of that together comes out and becomes your public health system. Your community and your individuals, everyone together collectively preventing, protecting against, responding to, and recovering from health emergencies that could happen to us in our communities. And Some of the things that we do to focus on that are, as Dr. Letson mentioned earlier, the monitoring for diseases, investigating health threats that we do on a daily basis. We also prepare for what if we were to have some kind of a large-scale event like a pandemic influenza. How would we prepare for that? Or in the case of what we're doing right now, preparing for Ebola. We communicate critical public health information to our partners through what's called a health alert network system. It's a networking system with our hospitals, laboratories, doctors' offices, police, fire, emergency management that all receive faxes, emails, blips of information from us, as well as sometimes telephone communication about something that may be going on that's a health threat that we might consider emergent at the time. And we also help our laboratories to build their capacity to deal with any kind of a large-scale outbreak that might be coming along. We are insured. We're very lucky here in El Paso County to be able to have a lab that can handle and test for some of our what's called a Category A diseases like tularemia and plague, West Nile virus. So they are prepared and able to test for those types of things, as well as to back up our hospitals for routine testing for influenza and other things of that sort. We are heavily involved in being able to bring in large-scale medical supplies should we need them for any kind of a big outbreak. So we work with the Centers for Disease Control on the Strategic National Stockpile. You might have seen some of this type of thing in the past with some exercises you may or may not have been involved in as community members, but in real events with H1N1, we gave over 10,000 vaccines out to our community through that system. And last summer, we did tetanus vaccines, practicing our points of dispensing through that system during Waldo Canyon. We actually used our drive-through pod plan to do the re-entry back into the neighborhoods. And we develop, practice, and improve our emergency response and our ability to rapidly respond to health threats by exercising and practicing on a regular basis. One of the things that Dan mentioned in the 10 essential services was to assure that we had a well-trained public health workforce. And in emergency preparedness, we work on that on a regular basis to ensure that our staff are well-trained in being able to give vaccines out to you, to quickly get medications out to the public, to man hotlines if we needed to do that, to ensure that we're responding. So we work daily to prepare. A lot of times the types of things that emergency preparedness does, they rely on things that are often unnoticed. The writing of the plans, the working with our partners to talk about what if this happens or what if that happens, how are we going to respond to that. Many of our preparedness activities are occurring on a daily basis with those types of collaborations that are occurring. And our preparedness activities can always be scaled up to respond to any large-scale emergency like pandemics, foodborne diseases, and bioterrorism. So the hot topic that emergency preparedness has been working on then is Ebola. And so any effective emergency response does require a lot of collaboration, requires us to collaborate with our emergency management partners. We need to have good community organization and public preparedness. We meet with all of our partners and have had numerous meetings in the community, such as with our Regional Healthcare Coalition, which is a group of all of those partners that I've mentioned a couple of different times that come together specifically to work on topics related to emergency preparedness, both from the hospital perspective, behavioral health perspective, and then as we have topics like Ebola that come up, we start looking at what kind of plans do we have if we needed to do a quarantine and isolation, or if we needed to do some large-scale disease investigation, if we needed to do some surveillance on someone, or we needed our labs to ramp up. How are we going to do that? What's the plan for that? So we get together with all of those partners. We talk through who's doing what so that we We're collaborating, we're making sure that we're covering all the bases. And then we talk through, where are our gap areas so that we can work on getting those covered. Here at El Paso County, in the county as well as with the health department, we do use what's called the NIM system, the National Incident Management System. It's an incident command structure that ensures that we are able to talk with all of our first responder partners in languages that they understand, that they can understand us, and that we understand what that, the order of how command is handled in an event, and that we're all working under that same structure. So on the slide you see the incident commander, the command staff, and then a finance, logistics, operations, and planning section. All of that is the same thing that you're going to see if you were to talk to fire or police or our emergency managers in the way that they structure themselves. And while we know that this topic is getting a lot of attention in the news, it's just one of the many emergencies that we could handle on a day-to-day basis. So what can you do to be prepared for emergencies? Number one, just be prepared. In this case, taking care of your family and your family's health. I think that Bill did a nice job discussing the need to take a look at, can you get vaccinated for diseases that are out there? Really, at this point, with influenza being the season and the amount of people that become impacted every year from influenza, we could get flu vaccine, and that would be a great way to be looking at how to prepare, how to take care of your own family's health. We can make a plan. Your family may not be together when a disaster happens, so it's important to plan in advance on how are you going to get everybody to a safe place. How are you going to contact one another if you're all in different places? Talking that over with your family ahead of time, making those plans ahead of time is a really great way for you to take charge of what you're doing for preparedness. Have a plan for traveling between your work and your home and your other normal community locations on a regular basis. Get to know your neighbors. I mean, a lot of times we especially in the wintertime, we drive right into our driveway and we open our garage and we zoom right in and close the door, and then you never talk to another soul again until you get up and go to work the next day, and you're only interacting with your coworkers. Get to know who your neighbors are. Talk to them about how you can create networks within your own areas, how people can network to assist each other with communication, maybe caring for a child or taking care of a pet for you, helping you out if there was an emergency of some sort. If you know somebody who has special needs in your communities, how can you help them with, if they were to need to be evacuated, for example? Can you know that ahead of time in case they can't call out for help? If you know who your neighbors are and who needs the help, then you can be that resource for them. And then finally, be informed. Learn what are the protective measures that you can take before, during, and after any kind of an emergency. And I think our last slide really does kind of to point to where can you get information. Get your facts, from your local health department. All of the links to everything we've talked about tonight regarding Ebola and other emergency preparedness are going to be right there on our website. We have the State Health Department if you want further information on Ebola-specific events, as well as Center for Disease Control. And then in Colorado, we have what's called the Co-Help Line. It's a line where you can call and specifically talk directly to somebody. They'll answer your questions. All of those questions are, retracked back to different zip codes so we can find out who's asking questions, in our communities. Are we answering the right information? They'll send us, messages about, if there's something specifically that we need to be working on, or we need to answer about our community in relation to any kind of a disease outbreak. So it's a great resource if you just feel like there's so much to read, I don't want to read it, but I want to ask a specific question. That's the place to go for that. Thank you.
Thank you, Lisa. And I will put in a plug here. This town hall, this forum, is being videotaped and will be available sometime tomorrow afternoon on the El Paso County YouTube channel. The way you get there is you go to our home page, elpasoco.com, and navigate over to the lower right-hand side, and you'll see the logos for Facebook and YouTube and all those. You can just click on the YouTube one and you'll be able to see and share the video. Here last week we posted a town hall meeting out in Black Forest on horse care, and we had 900 views on that in the first 2 days. Probably not too surprising. With that, we kind of have the conclusion of our formal presentation. I'll call on Health Director Dan Martindale to kind of wrap up that portion, and again, we'll have some time for questions and answers.
Thanks, Dave. And again, I want to thank everyone for coming out. Certainly feel free to call us at any time, email us with any questions that you may have in the future. We're there to assist you, and we will get you the answer to the public health questions that you have. Again, as you can see, we have experts working at the health department, experts that have years and years of service and experience, and we are here to help you. We are your El Paso County Public Health Department. I also want to thank Commissioners Lathan and Clark for hosting this event. We certainly look forward to more events like this in the future so that we can educate and inform the public. So with that, again, thank you. And Dave, I guess we're ready for questions.
Does anyone have a question for any of our panelists? Raise your hand. We'll deliver a microphone to you. No questions? That was easy. Yeah, that was easy. Well, again, thank you so much for coming. I'll let our commissioners kind of wrap up the evening.
Thank you. Again, thanks, folks, for taking time to come out. We certainly like to talk about all of the services and share those pieces of information with you that come from public health, because public health is so important in so many ways, and a lot of times folks don't realize how much is offered through El Paso County Public Health. And as a reminder, that's for every citizen of El Paso County, whether you live in a municipality or not. This is where the public health services come from. And so we thank you for taking time. We want to make sure that questions and concerns, especially with an issue like Ebola that is in the news so much, is understood with the facts. And that, of course, we have to be vigilant, we need to be prepared, but we also don't want to have people overly worried about something based on information that maybe is coming across the internet that's not accurate, or whatever the case may be. We want to make sure that you have the facts. And so hopefully this is informative, and we've been able to share some good information with you.
Yeah, and just to kind of close on that too, when you think about local government and county governments in relation to emergencies, think about the folks in West Virginia when there was a chemical spill. Who delivered 1 million bottles of water to the residents? It was working with the local county officials, with public health, with utilities, with various agencies. It's your local government that responds. And I think that's what's important here to remember, that not only are we the responding agencies, but we're the disaster recovery agencies, and we're in the process and always in preparing for the likelihood of what may happen. I just noticed on my Twitter account, there's a new term called Fearbola, that everyone is concerned about Ebola, but then you look at the numbers, staggering for influenza, and 50,000 people in 2010 died of influenza, the flu. So we need to really take that into context and utilize your local public health folks, utilize us, or your Board of Health, those local officials who can put you in touch with people that have the facts, and don't just believe everything you read. I remember reading, actually on Twitter, came across during, I think it was the Waldo Canyon fire, that 1,200 homes had burned. Well, we know that's not true, but people who are reading that don't know that's true. So check out your facts, utilize public health if you have questions, and having a phone number the old-fashioned way is also helpful, that you don't have to necessarily go through just learning on a website. Pick up the phone. It's okay to call if you have a concern. So thank you for coming tonight. It's important that we share this with you and that we share it with the public and those folks in the medical community, and help us sort of share the factual information with other people. Utilize the information you learned tonight to be able to discuss this in a more, I think, thoughtful way. And thank you to our experts here on the panel. We certainly appreciate all that you do from the public health arena, because public health, like no other, really provides that basic emergency preparedness when it comes to keeping you safe.